Namaste and welcome to 19th episode on Nursing Officer with Pratiksha Bhandari. Under Nursing Concept and Principles, today we will be discussing on nursing ethics under professional development. Contents under nursing ethics are: what is ethics, what is moral, Asian Code of Ethics, ethical principles and dilemma, ethical responsibilities of nurses, important steps of ethical problem solving. Ethics is the branch of philosophy and that concerns the distinction between right and wrong based on the body of knowledge, not just based on opinions. It mainly deals about the right and wrong, but the difference is that it depends on the body of knowledge, not on the opinions, while morals depends upon the beliefs, opinions and attitudes that guide our actions. As we see, there is the common between ethics and morals is that both of these deals with right and wrong of action, while ethics have some external rules but morals have personal principles or personal opinions, and ethics varies with a time or environment, while morals rarely change. Asian Code of Ethics for Nurses, यसको चाहिँ छुट्टै टपिकै छ है हाम्रो करिकुलममा एसियन कोड अफ नर्सिङ भनेर यो हामी डिटेलमा त्यो टपिकमा हेर्छौँ. There are 4 principal elements that outlines the standards of ethical conduct, and they are nurses and people, nurses and practice, nurses and the profession, nurses and co-workers. There are ethical principles that we should know. Okay, respect for persons. It deals that every individual is so unique and free and have right to informed consent, has own value and dignity, has the right and capacity to decide. So it directs the individuals to treat themselves and others with respect inherent to man humanness. Autonomy is the self-determination and right to make one's own decisions. For example, a client should be provided to take informed consent before doing any procedure, and it's the autonomy of the patient. Respect for freedom. Everyone have their own right to freedom and we should respect the freedom of the person. It means to select and pursue personal health goals. For example, whether the patient want certain procedure for him or not. Beneficence is the action that one takes should promote good beneficence. Non-maleficent is the duty to do no harm. We should be familiar with this term too. Justice is the fairness and there is the equitable distribution of risk, benefits and task, everything. It means the fairness in distributing the resources in healthcare, and nurses should allocate them in such a way that equal shares go to equal recipients. Veracity is the obligation to tell the truth. For example, whatever the condition is, but like bad news about personal health status, so whatever it is, we have the obligation to tell the truth and we should follow the ethical principle. And fidelity is being faithful to agreements and responsibilities one has undertaken. Okay, there are such ethical principles and we face the dilemma while performing the principles. For example, while following one principle, we will be confused that whether we are hampering or we are overtaking another principle. when ethical dilemma occurs, it results in problem in making a decision, because there is no clear correct or right choice, because there is nothing written it is correct and it is wrong, it is not written, but we should know it on the basis of the knowledge, on the basis of theory, and it cannot be made on the basis of personal opinion. So there falls the ethical dilemma. Our responsibilities as a nurse in ethics are to conceptualize the ethical terminology, as you have already seen the ethical principles. Similarly, give respect by maintaining dignity and autonomy of the client, showing strong commitment with patients, safety and standards, maximize the client's well-being and protect other clients' well-being, and advocating for patients. There are some important steps for ethical problem solving so that we don't fall under ethical dilemma. Okay, कुनै पनि एउटा एक्सन अकर भयो हैन, अब त्यसमा चाहिँ हामीले कुन प्रिन्सिपल फलो गर्ने, हाम्रो इथिक्सले के भन्छ भन्ने कुरामा अब त्यो जान्छ भनेदेखि, अब कुनै पनि एउटा एक्सन भएको छ भने, एउटा कुनै पनि प्रब्लम अकर गर्यो भनेदेखि त्यो प्रब्लम रिलेटेड वी नीड टु कलेक्ट द रिलेभेन्ट फ्याक्ट्स एन्ड we should identify feasible options for the solution of the problem, and we should assess the effect of each option, and after assessing the effect we can determine the most appropriate action by establishing criteria and selecting the best option based on the established criteria, so there is less chance of ethical dilemma and we could more easily solve the ethical problem. And let's see some sample MCQ. Question number 1. The personal conviction that something is absolutely right or wrong in all situations is options: values, morals, ethics and standards of practice. Next one is the one that promotes the philosophical and theological study of morality, moral judgment and moral problems. अब दुईटा क्वेसन छ है। अब एब्सोल्युटली राइट एन्ड रङ भन्ने बित्तिकै हामीले राइट र रङ भनेर त इथिक्स एन्ड मोरल्स भनेर दुईटा हेरेको थियौँ है। अब यसमा पनि पर्सनल कन्भिक्सन भनेपछि इथिक्समा कहिले पनि पर्सनल ओपिनियन हुँदैन, सो द करेक्ट एन्सर फर दिस इज मोरल्स। नेक्स्ट वान इज द वान द्याट प्रमोट्स द फिलोसोफिकल एन्ड थियोलोजिकल स्टडी अफ, अब यहाँ चाहिँ मल्टिपल टाइम्स मोरालिटी, मोरल जजमेन्ट्स एन्ड मोरल प्रब्लम्स भनेर भनेको छ होइन, बट जसले चाहिँ फिलोसोफिकल र थियोलोजिकल स्टडीलाई प्रमोट गर्छ भनेर भनिसके पछाडि द करेक्ट एन्सर इज इथिक्स। ओके, so we don't fall in confusion, and that's all about nursing ethics. Thank you so much, and trends on nursing will be discussed on 20th episode. Please comment any queries or suggestions and subscribe us for getting notifications to our updates. Thank you.